diet-related disease now contributes to more disease and death than physical inactivity, smoking, and alcohol combined. That's from the Global Burden of Disease Analysis, published in The Lancet in 2015. Read it again, because it reorders every public health priority you've ever been given. I'm Dr. Padda. Today, how the most consequential dietary advice of the 20th century got made, why it was wrong, and why it took 50 years to admit it. Let me start with medicine's own house. The Academy of Medical Royal Colleges and the British Medical Journal have both called for a serious effort to reduce the harms of what they call too much medicine, SHIETS, overdiagnosis, overtreatment, and polypharmacy. The Choosing Wisely campaign exists to teach patients one question: are there simpler or safer options than the prescription I'm being handed? You will hear it claimed that prescription drugs are the third leading cause of death. I'm not going to say that, because when you follow that number back, it rests on a 1998 analysis of data from the 1960s, and it has been substantially disputed. Careful estimates place adverse drug reactions somewhere around 4th to 6th as a cause of death worldwide, which is bad enough without inflating it. The honest version is this: properly prescribed medication, taken as directed, causes real and systematically undercounted harm. That's not an argument against medication. It's an argument for asking whether the thing causing the problem can be removed instead. And overwhelmingly, the thing causing the problem is what we eat. More disease and death than inactivity, smoking, and alcohol combined. We spent 40 years and enormous public resources on tobacco. Correctly, it worked. It saved millions of lives. We have spent a fraction of that on diet against a larger burden. In 1977, the United States issued its first dietary goals. The central instruction was to reduce fat. And when you tell a population to remove fat from the plate, something has to replace those calories. What replaced it was carbohydrate and industrial seed oil. Between 1961 and 2011, roughly 90% of the increase in American calorie intake came from carbohydrates and polyunsaturated vegetable oils. We also created an entire food category: low-fat. Low-fat processed food is, almost without exception, higher in sugar, because when you remove fat, you remove flavor, and sugar is how the flavor comes back. The obesity curve in this country turned sharply upward within a few years of 1977. Correlation is not causation, and I'll say that plainly, but it is a very poorly timed coincidence. Here's what makes it worse. A later analysis of the randomized controlled trial evidence that was available before 1977 found it did not support the fat restrictions that were issued. The guidance ran ahead of the data. Professor John Ioannidis at Stanford is one of the most cited researchers in medicine, and the person who has done more than anyone to expose weak methodology in his own field, has said of nutritional epidemiology that it is a scandal. It should just go to the waste bin. That's a strong opinion, and it is an opinion rather than a study finding. But it comes from someone whose entire career is the statistics of research reliability, and the underlying complaint is fair. Much of what we call nutrition science is correlational, self-reported, and unable to separate the effect of a food from the effect of the person who chooses it. Max Planck said science progresses one funeral at a time. He wasn't being cynical. He meant that fields change when the people invested in the old model retire. It took roughly 50 years from the first published evidence linking smoking to lung cancer until effective regulation arrived. That delay was manufactured. The tobacco industry ran a deliberate strategy: deny, manufacture doubt, and fund friendly scientists. Researchers who studied that history have documented how closely the food industry's playbook resembles it. And the incentive is structural rather than villainous. A public company has a fiduciary duty to produce returns for shareholders. It does not have a fiduciary duty to your metabolic health. Consider that current guidelines accommodate something on the order of 22 teaspoons of added sugar a day, as within normal intake, for a nutrient with no dietary requirement and no biological necessity whatsoever. There is no such thing as an essential sugar. None of this means your doctor is against you. It means the information environment they were trained in was contaminated, and correcting it is slow. In the next video, we get to the actual evidence on dietary fat, and it is not what you were told. Padda Institute Center for Interventional Pain Management, St. Louis, 314-481-5000. Educational content only, not medical advice.